1 in 4 women during menopause will lose a tooth, unexpected. But that's not all. It's also about our sleep. Sleep disordered breathing rises sharply after menopause.
When you fall asleep, the muscle tone relaxes, jaw falls back, the tongue falls back, and that starts narrowing the airway. Let's do a test. Try to make the snoring sound.
Oh, I can make it.
Now move your jaw forward and try to do it.
Oh, you can't do it.
You can do it. There's 2 ways of test for sleep apnea. The husband is one of them, right? Because that will tell you you're snoring.
You're snoring for the first time in your life. If we knew the language of our oral cavity, we would be able to say, oh my God, something's happening. Let's go find an expert.
You have to check your sleep, because if you have fragmented sleep and you don't go through deep sleep, that is the recovery stage, then you start affecting your system. What happens is that
Hey everybody, I have some really shocking data that I only came to know recently. You know, I've been on this deep dive, becoming an expert in midlife and perimenopause and menopause. But one of the last things that I learned were some of these statistics. Postmenopausal women are significantly more likely to develop periodontal disease, up to 50% more compared to premenopausal. Guess what that's from? Up to 60% of menopausal women report xerostomia, or dry mouth. And it's not just being nervous, right? Women with osteoporosis, we talk about osteoporosis all the time, are likely to experience tooth loss. What? In fact, as I did a deeper dive, 1 in 4 women during menopause will lose a tooth. Unexpected. But that's not all, right? Because it's not only about our teeth and our smile and our chewing. It's also about our sleep, right? And so these are shocking. Sleep disordered breathing, including sleep apnea, rises sharply after menopause. And to top it all off, chronic gum inflammation is associated with all the other systemic inflammation that we experience. I mean, somehow chronic gum inflammation is associated with the frozen shoulders you come into me with through the link of inflammation. So I was thinking about all this. And then I was laying in my dentist chair, because I do go relatively every 6 months to get these teeth taken care of. And so I'm laying there thinking, oh my God, I've got to ask Dr. Menendez about this. So today on Hot for Your Health, I have my own dentist, Dr. Carlos Menendez, who is the owner of Nona Smiles. If you've never been, you need to go, because it's like the most posh luxury dental experience I've ever had. In fact, I sent my daughter, who's now 18, and she can come see you now, to your office for the first time versus her pediatric dentist. And she's like, Mom, there was a menu. I could get a blanket and I could get an eye. It really. So thank you for making what can be a terrifying experience, right? Because most people are nervous to go to the dentist. Nobody likes to go to the dentist. Really calm and luxurious. But Dr. Menendez, I want to jump right in and first start with helping people understand when we talk about dental health. I think the first thing that pops into our heads are things like cavities or root canals or
deep cleanings.
Deep cleanings that hurt.
Everybody talks about deep cleanings, yes.
But the reality is oral health is much bigger than that.
Yes.
Especially for midlife women.
Correct.
Can you go down that pathway for us?
Absolutely. First of all, part of my slogan at the office is like, we don't treat people's teeth. We treat people with teeth, so it's like the whole thing. And like listening to you talking about the reality of like sleep breathing disorders, gum disease, and not recovering properly, it's all together. It's all tied up together. So when it comes first to oral health, yes, you have to go to your dentist every 6 months. Why? Because we have to make sure that we don't have any plaque accumulation or buildup, which leads to just gum disease. But now we have to start putting together what comes first. And when you have your menopause or perimenopause patients, there's some signs and things that you should start noticing that you should raise a flag and prone you to just go to the dentist. let's talk about different things first.
Okay.
And we can break it down from
Yeah,
the outside to the
that's
inside,
right. Let's go.
because why is how we look, how we feel, and then it comes to the inside of the body.
Okay.
So we can start talking about a little bit of the skin. And menopause patients, they have less estrogen, right? So we have less production of collagen, and then you end up losing the elasticity of your skin, and then you start developing wrinkles. And that's why, even though as a dentist, I do also some botulinum toxin, and then you start the request, can I get some Botox? And then get rid of the wrinkles. But the reality is that the wrinkles are happening because, again, less elasticity. And you know about that. You talk about that, right? About
We
the
can lose
collagen
30%
production.
of our collagen as
Right.
estrogen stops being produced by our ovaries.
Correct. So then we have muscle tone. And then we start sagging of the face, eyes, the black circles around the eyes. Nasolabial folds start to just get more noticeable. And these lines over here, your lips start to just droop a little bit. It's called the marionette lines. And there's a lot of things that's happening. One of them is, again, muscle tone. The other one, part of the things of sleep disorder breathing, and I'm going to start tidying all the sleep apnea issue, is grinding of the teeth. So when you grind your teeth get shorter, this space over here gets reduced. So you start developing like a droopy of your lips, angular cheilitis, which is the inflammation. Also, if we tied up a little bit the sleep, usually patients that develop sleep apnea or having sleep disorder breathing, they are mouth breathers. So everything gets dry. Okay. And then that also increases the inflammation of the gum. Now we're going to start getting more into it inside of the mouth. Then we have the lips. We start losing subcutaneous fat. Lips start to just get thinner. And then the patients start asking, can you do fillers? Right? And then we start getting the little smoker lines where, when you put your lips that you're going to drink a bottle of water, you see the wrinkles. Same thing, fillers to just fill, and they just hide the aging part of it. But it's also tied up to the collagen production, that start happening when we have less estrogen on your patients. And right,
That's
we
right.
see every day.
I mean, all those things, we certainly notice them, but typically the response is, how do I fill it back up from the outside in, right? Instead of, I don't want to interrupt you because I know you're about to get into the mouth part of this, but instead of thinking about how do we refill from the inside out with replacing our estrogen or eating things that augment collagen okay, so you made it to the lips, and what happens surrounding that without estrogen, but what happens inside?
Okay, now this is the trick.
This is
Now
the big.
this is
This
the important
is the
part, and
big
that's
part.
when we
Yeah.
as dentists, we start to just notice all these things.
Yeah.
Even before the patient notices that they're struggling, right, with lack of estrogen, lack of collagen, and yeah, nutrition, like you mentioned, is super important. Like supplements like vitamin C, good protein intake, omega-3 to reduce the inflammatory process, and hydration. Now it comes to the teeth. When it comes to the teeth, then soft tissue, the gums. When we have less estrogen, we have less collagen, and collagen is a crucial part of that makes the soft tissue, the gums, oral mucosa, right? So when we have less estrogen, less collagen, soft tissue gets thinner. You can have something called menopausal gingival stomatitis, which is like inflammation of the gums or thinning of the gums. You get like a burning sensation of your gums, and then you get xerostomia, which you already described as the lack of
mouth.
saliva.
Yeah,
the dry mouth. So when you have all that happening, the gum can start getting receding. You can start getting receding gums.
It pulls back from the teeth.
It pulls back from the teeth. The teeth start to just look longer. The smile start to look like it's aging. Then the enamel is the beautiful part of the teeth that you can bleach, and it gets whiter, right? We try, right, always to bleach. But when you start getting receding gums, you start noticing yellowness at the gum line, right? Because the root surface is yellow. There's no enamel. But as not having the enamel, you don't have that protective layer. The enamel is the stronger part of the body. And if you can destroy enamel, the body can just come apart very easily, right? So when you have the receding gums, patients start having more sensitivity. The root surface, the enamel is super strong, and the roots is, again, as not being protected, it can get very sensitive to sweet, to cold, to heat, even brushing your teeth. And then you have to start supplementing yourself with sometimes like fluoride therapy to just counteract the effect of sensitivity. Some patients, we have to refer them to the gum specialist to just try to cover the soft tissue. But if there is issues with collagen, and sleep also is a big factor, because if you have less oxygen, when patients experience sleep apnea, you have less oxygen. A sleep apnea episode is considered when you stop breathing for more than 10 seconds. And that happens on sleep apnea patients multiple times overnight. And then you have fragmented sleep. So oxygen is super important for the synthesis of collagen. So if you have less oxygen, you have less fibroblasts, which produces collagen. And then breakdowns start happening. Also, inflammatory processes start happening, like TNF factors start to just increase, and IL-6 start to increase.
You know what it sounds like to me is that what starts out just seeming like, oh, I'm getting these crow's feet or these labial folds I've never had before, is really this cascade on the inside that can be a disaster, right? Because as I'm sitting here listening to, oh, my gums are going to get thin and receding, and then that's going to expose a part of the tooth root that was never exposed, right? It's not strong enough. It's not covered by enamel.
Correct.
And then with a dry mouth, the very pH of the mouth changes. Are you going to rot out the roots of your teeth? Because I'm like, oh my God, it's a cascade.
Yeah, it is a cascade. So you're mentioning saliva. Saliva is a natural buffer. It neutralizes the acidity in your mouth. That's why, let's say you're normal and you don't have any issues. In the morning, automatically when you go through the oldest stages of sleep, during REM, which is the rapid deep sleep, rapid eye movement sleep, body temperature reduces, movement, you're paralyzed, right? Saliva flow reduces.
So you don't choke, or just
perhaps
conservation of energy or something.
So what happened is that's why in the morning you wake up and you have more like that bad breath in the morning, because
it changes the bacteria.
Bacteria are at their peak.
In acidic environments.
In an acidic environment.
That makes so much sense.
So if you don't brush your teeth right before, let's say, having breakfast, then you're feeding all these bacteria with nutrients to start growing, and byproducts is acidity, which erodes the enamel of your teeth. And then you're more prone to develop cavities.
Got it.
And then if you get cavities around the enamel, especially in between your teeth, if you don't floss properly, the root surface gets cavity
because it's not covered in enamel.
It's not covered. So then you start having these patients with xerostomia or dry mouth developing cavities at the gum line. And then they start looking like they look normal. They look at the mirror. They start noticing like it gets yellower and darker yellow. They get brown. They get dark, and that's a cavity. And that gets to the point of no return. And that tooth is going to get lost because of a cavity. Okay.
Because you can't fill a root cavity like you could
You can. The only thing is that you cover it basically with a fake material, which sometimes, if it is not finished properly, the patient start getting more plaque accumulation around the filling, and it's like a chain reaction. It just creates more inflammation. The hyper response to the plaque when you're menopause is high. It's like very aggressive compared to a normal person.
Interesting.
So the inflammation happens, and then again, it's a chain reaction. You have less saliva, and then recessions start getting bigger and bigger and bigger.
You may think your bones are fine, silent, but if you're a woman over 40, your bones are talking to you. And unbreakable bone is how you answer back. During perimenopause and menopause, your bone loss can triple without us even knowing it. That is why I created my 8-shield Building Better Bone program, including Unbreakable Bone Nutrition Augment. Built on clinically studied collagen, microcrystalline hydroxyapatite, and the essential micronutrients your skeleton needs. It's the only formula designed by an orthopedic surgeon who spent 25 years rebuilding bone, muscle, and movement. Stronger bones are the foundation of a longer, more powerful life. Start building your unbreakable era today at shop.drvondawright.com.
So when we are going through perimenopause, many women don't realize it's happening. They just know they don't feel like themselves. But then they start not sleeping as well. Not sleeping well is one of the first and most 80% of women say I stopped sleeping well, whether it's true sleep apnea or we're waking up at 2:37 in the morning because our sugar's dipping, our hormones are changing. For so many reasons, sleep is one of the first disturbed things. But and then night sweats, brain fog. But I consider what you're telling us is happening now almost the same as I consider the chemistry of the brain changes. The heart starts developing microvascular disease. We can lose 20% of our bone density. None of us can see or feel those things. And I almost feel like while we can see the changes in the mirror, most of us are not conscious of what's going on inside the mouth. How quickly do you see, because you see people every 6 months, do you see a change from January to June in women who are in perimenopause, or does it take several years to see these changes?
Well, I would say that it could take several years, but every case is very specific. And we were discussing earlier about this specific case that I'm treating right now. Elderly, no, I would say like she's in her late 60s, patient that she ended up losing all the teeth because of xerostomia. I've been seeing her frequently. She ended up having the last teeth that trying to just emotionally try to get attached to them. Yes.
Yeah.
But it was getting to the point of no return where like they were getting recurrent decay around the gum line. Difficult. The patient, I feel so bad, or bless her heart, like she talking is difficult because her lips get stuck. There's no saliva. So she always have to be drinking water, using a product, always like a little spray, like biotin, like product, which is a saliva stimulator. And still like her upper dentures were not staying properly. So we did recommend, okay, let's not deal with the teeth anymore. Let's have them removed. And you need function, right? You need to eat properly.
Yeah.
So we discussed it with the oral surgeon, and the goal was to put some dental implants and put what we call implant supported denture. It's a fix, right? I'm the only one able to take it out, or the oral surgeon.
Oh, I got it.
So it's like screw
fixed,
to the
yes.
implants. So we did the implants, I would say like less than a year, and a lot of thousands in investment, right? And I saw her last week. We did remove them because we remove them at least once a year to just clean them.
Yes, of course.
And look for the stability of the implants and clean the platform of the implants. And when we did x-rays, the most posterior implants, the bone was gone. Basically,
the bone was gone.
Basically, the tip of the implants are attached right now.
Yeah.
So we start digging in. Patients suffering from osteoporosis, lack of saliva, right? Collagen is the structure that creates the jawbone matrix. So when you have less collagen, speed up the process of bone loss.
Yes, right.
So we noticed that happen, and we were like, "What happened here?" And then we started digging in. And then the patient reported the oral surgeon that she started taking Fosamax
to build her bone for osteoporosis.
To prevent the degeneration of the bone. So Fosamax is an implant killer. They call it an implant killer because there's no bone regeneration.
There's no remodeling, so it cannot grow into your implant.
And even if there is remodeling, it takes longer. So patients are more prone to develop secondary infections because the tissue never heal, and osteomyelitis. So it's like the infection of the bone. So it's like a catch-22.
It's a cascade. And in fact, many women that I talk to about their osteoporosis, because whether it's in my office or online, number one, I talk about bone all the time, but I measure bone densities on everybody, not just, insurance pays for a bone density scan at 65, which in my opinion is way too late. So I do it on 20-year-olds and 30-year-olds and 40-year-olds. And in talking to people whose osteoporosis is so severe, meaning you'll remember people who have heard me say this before, but the definition of osteoporosis is minus 2.5 on a T-score, which means that if we say a 30-year-old's bone density is normal and healthy, which it all isn't always, honestly, then osteoporosis is 2.5 standard deviations below that. But the point being, that's the point when doctors start presenting using things like Fosamax or Prolia or any of the medications because
There have been multiple ones, yeah.
exactly, because the risk of fracturing a hip is often death, right? But this is something nobody talks about, and I hope you will continue talking about it. The other consideration of, okay, we're trying to save your hips and your spine, but what are these medications also doing to your teeth and the jaw and because no one's talking about that. So I hope that this stimulates a new conversation.
And I have had in the past, like patients, they come with a kind of medical clearance from the orthopedic surgeon, like requesting complete dental evaluation, complete checkup because the
Before
patients
an
are going to
implant,
be
a total
not only that
oh.
implant, before they put the patient in the medications.
Oh, really?
Yes, I
That's
have
very
had
good
that.
of
So,
them.
so it's good of them, yes,
Yes,
because
do that.
we want to make sure that their oral health, the initial oral health before the medication, it's optimal.
Yeah.
But still, like it happens that if the patient have already a previous dental treatment, like a root canal, and the patient start grinding, if they break the tooth, it's not only about the implant. If we're going to do an extraction, it's the same issue like the implants. There's going to be an open wound inside of the jawbone that it takes time to heal when the patients they're taking this kind of medication. So we have to be on top of the patient with the follow-up, and sometimes they have to take antibiotic after antibiotic because the delay, there's a delay response.
In healing.
Yes.
That's interesting.
So we have these patients and we let them know you have to be on top of this.
Yeah.
Regardless if the insurance pay or not for your cleaning,
you
have to just get a check. Especially they have most of the adult patients also, like 50 plus or so, they have a lot of dental work done in the past. So no, it's not only about the teeth, it's not only about the receding gum, it's about what happened, how stable is that dental work. The most common thing in dentistry, the dentist will tell you, you need a crown, right?
Oh, right, to cover the tooth.
To cover the tooth. So the crown, we have to shave the tooth all the way around, right?
Taking off all the enamel.
It's like peeling an apple. You just take all the skin of the tooth, the enamel, and you're going to replace it with ceramic. Nowadays, we use zirconium oxide, which is a very healthy, strong material, and for some reason, very biostable with the tissue, and you don't get that much inflammation like the other, what we used to call porcelain fused to metal crowns. And the metal, sometimes there's some nickel and there's a high precision
of
allergy, so you get the inflammation response. But the whole idea behind a crown, you want to have the finish line of the crown nicely polished and flush with the tooth. Otherwise, you start getting black. Now, patients with lack of saliva, they start to just get in recurrent decays around all work. Now,
oh my God, there's a pattern
there's so
here.
many things. And then when you have x-rays and you have a material that is radio-opaque, and radio-opaque means that you cannot see through it. So if they're developing a cavity inside of the crown,
you can't see it.
You can see it until the patient
tooth falls out.
Not fall, but the patient comes with pain.
Oh, pain.
Because then the cavity will start growing in an ideal environment. It doesn't get disturbed. It reaches the nerve. Patients start coming with sensitivity, or the cement dissolve and the patient comes with a crown. And then there's like a rotten tooth. So then a root canal is needed. Then
it just goes on and on.
And then if the root canal fails, then the tooth needs to be pulled out, and then an implant. And if the patient is taking osteoporosis medication, then it
might not grow.
You cannot get an implant. Then you have to have a bridge, and then you have to compromise 2 more teeth to just do a bridge. So just to summarize, we have to just have patients educated in the importance of going to the dentist. It's not only about teeth. If you start adding all the things that we've been talking here, she invited me because I'm the dentist, and dentists usually talk about teeth, but it's about putting together your age, hormonal disturbance, sleep, right? And then, like we mentioned, we talk about the skin, the muscle tone. Then we start if we start tightening why someone who wasn't snoring before starts snoring. When we start losing muscle tone, it not only affect the skin and the sagging of the skin, it's just the airway. airway there's no bone supporting the airway. It's just soft tissue. It's just
so
muscle.
if we lose 30% of our collagen everywhere, including the soft tissue of our oral cavity,
Yes.
well, the back, if you guys are playing with your tongue right now thinking, oh, the hard palate, and then behind it there's the soft palate where the uvula hangs down, that
Yes.
thing, and the tonsils intrude on the sides, or unless they've been taken out. Does that sag?
Yes.
It begins to sag and obstruct an airway.
So when you fall asleep, normally which side is your favorite one?
Which do I sleep on?
Yes.
My left side.
Okay. Do you sleep normally in the back as well?
I also do sleep on the back.
So when you have gravity and you have soft tissue, the tongue is attached to the lower jaw, right? So if you're in a couch watching a movie or your husband and you look at him suddenly and he's right with the mouth open.
Yeah,
So the muscle tone relaxes, right? Jaw falls back, the tongue falls back, and that starts narrowing the airway. So you have a same volume of air going through a very, and then it creates the vibration of the tissue. Let's do I'm going to put you in the spot.
Okay.
Let's do a test. Try to make the snoring sound.
Oh, I can make it. I have to close the back of to do it, I have to close the back of my mouth.
Okay.
Yeah.
Now move your jaw forward and try to do it.
Oh, you can't do it.
You can do it, right?
Oh.
So that's the goal. If you're experiencing sleep apnea or think that you have sleep apnea or snoring, first step is to get tested.
Yeah.
There's 2 ways of test for sleep apnea. Well, 3. The husband is one of them, right? Because that will tell you're snoring.
You're snoring for the first time in your life.
Yes.
Yeah.
So the other one is a HST. It's a home sleep test. And that's very simple. Nowadays with technology, they have the ring, they have all the things. And it doesn't measure sleep stages, but it measures oxygen drop at nighttime.
Oh.
Position. Sometimes record snoring. Or the polysomnogram, which is the one that you have to go to a clinic. You have
lay
like
there with
27
wires over.
not sleeping in your
sleep
bed.
with that?
Someone is watching over you.
Yeah.
And but with that test, they measure stages of sleep. So they
got
know
it.
if you're going through stage 1, 2, deep sleep, which is the crucial one because growth hormone gets produced and that's when collagen gets repaired. So if we don't go through deep sleep, testosterone in guys is affected and ED is like higher. And growth hormone, which is again collagen repair, important to all the functions in the body, right? And then REM. So if we don't go through, I was saying like a polysomnogram measure that information. So the first step is getting tested. HST, a polysomnogram. Once you get evaluated, those tests is going to spit out some information. So sleep apnea is categorized in 3 different levels.
Okay.
You have normal when you stop, and I mentioned that a sleep apnea event is when you stop breathing for more than 10 seconds.
That's a long time.
It's a long time. If you try to hold your breath for 10 seconds,
you're going to notice
like, oh my God.
Yeah.
So 0 to 5 times, that's considered a normal person. Like we all have some episodes.
Some episodes.
Yeah.
Okay.
From 5 to 15, that's mild. 15 to 29, that's moderate. And 30 and above, that's severe.
Yeah.
I have seen patients, and that is considered the AHI, apnea-hypopnea index. An apneic event is when you stop breathing completely. Hypopnea is when there's a reduction up
Of
to
your
30%.
oxygenation?
Yes. So when you combine them both, that's spit out that number. So let's say if you have an AHI of 33, that means that you stop breathing 33 times per hour for more than 10 seconds a night. And if
That's every 2 minutes.
Yeah, if you do that every night, you feel like crap the next day, So you have fragmented sleep. What happens is that you don't remember that. It's like when you snore, you don't remember that. Or when you grind your teeth, you don't remember any of that. You start seeing signs and symptoms. So when you stop breathing and you feel like, oh, I feel like crap, but I spend like 8 hours in bed, You have to check your sleep, because if you have fragmented sleep and you don't go through deep sleep, that is the recovery stage, then you start affecting your system.
Oh, everything.
Collagen gets reduced. Collagen also helps in the production of blood vessels. So you lose elasticity. So what happened when your heart start pumping blood and you have non-elastic vessels? You start increasing the blood pressure, and then patients start developing heart disease.
Heart disease, right.
And then also part of the things with the sleep apnea, some patients says, oh, I'm waking up at night because I have to go and pee or void, right? And the reality is that because when you fall asleep and you have less elasticity in your blood vessels, all the blood goes into the heart. And then the atrium releases a peptide, it's called ANP. And it goes to the kidneys, and vasopressin gets reduced. And vasopressin controls the homeostasis, like water balance in the body.
Yeah.
So the body says, I have too much blood. I have to
I have to get rid of some.
I have too much pressure. I have to get rid of some. So you wake up multiple times to pee. So if you get the sleep apnea under control using, let's say, the CPAP, which is the continuous positive air pressure, you have to wear a mask. That's the only thing, and nobody is not that sexy. And I don't picture someone like as like in their 40s like wearing a mask. Oh, honey, I'm gonna put a mask because I have to fall asleep, and instead I have like Darth Vader next to you. You know.
That's so.
Or you have what is called mandibular advancement devices, which is it's like a night guard, 2 night guards, and it's like to keeping like we did the exercise,
like your
to
jaw
keeping your
forward.
jaw from collapsing. You know, so you don't your tongue doesn't shut down the airway. So or weight control, right? And they have other techniques like it's called the Inspire, which is like a pacemaker. It's the diode that goes to the tongue, and when you have less oxygen, it just pushes your hypoglossal nerve to just push your tongue out and opens.
I wondered how that worked.
It's not for everybody, but there's a remote control that you need to activate it to turn it on. But if you forget to turn it off, the next day you're in the
well, you know what? All of this, we're going down this pathway, and everybody's out there like, "Oh my God, that's me! It's so terrible."
Yes.
It is, because the way you've just put it together, that the loss of estrogen leads to loss of collagen and all the changes in your oral cavity, but then also the changes in sleep because of the tissue laxity, and then that leads to heart disease and kidneys, and
that's why we treat people with teeth.
Oh, that's right.
Yes, that's right.
Do you know there's a phenomenon, not to sidetrack, but you're describing so much of what goes on in sleep or lack thereof. There is this phenomenon that in my world people joke about, but it is real. It's called sleep divorce.
Yeah.
Because
we can save marriages.
Yeah, right. That's what I'm kidding. I'm not really kidding. When I had my husband come sit in that chair and we were talking about relationships, family relationships, because I describe this time, it's menopause, but I call it the menolescence because it's hormonal, social, physical, psychological, but the social part is real. And the fact that people, because of all these changes of their sleep, it's not a personal thing. It is a relationship thing. So sleep divorces, people talk about it all the time. And it's not for lack of liking this person that you've committed to. It's getting up all the time.
Yeah.
It's the snoring
it
thing.
becomes bothersome
it's the
to everybody
hotness.
else. Yeah.
So it's just another one of those things.
And something else that we were talking before is like we were talking about. It's like a catch-22.
Yeah.
Like menopause females that they cannot sleep well.
Yeah.
They start gaining weight, and
Yes.
the gain of weight, it could be not only because of collagen issues or the estrogen. Also, there's a study that patients that cannot sleep well and are suffering from sleep apnea, there's a hormone that increases the appetite, which is the ghrelin. And then what happens is that they wake up the next day craving for junk food.
First thing out of bed,
and then
right?
sweets, and then it's gain weight, cavities. Because it's not that they're eating the proper stuff. It's just
we're not eating celery.
Yes,
right?
Exactly. And on top of that, if the home care is not the best, then you leave plaque in between your teeth. Cavities start to just increase. You're not going to the dentist, and I get a lot. And I get that society is not getting any better when it comes to the word that they use everybody right now, like affordability, right? But sometimes they use the excuse, I don't have insurance, so that's why I don't go.
Don't get your teeth
don't
cleaned.
get treated. But the reality is that it's going to be more expensive down the road. And it breaks my heart when I have to tell a patient, this tooth, we have to pull it out. We're not in the business of pulling out teeth.
No, you'd like to preserve teeth.
Correct,
I'm in
yes.
joint longevity.
Yeah.
You're in teeth and mouth longevity, right?
Correct.
Like,
So,
yeah. So if we stop this conversation here, it sounds pretty dismal, but I want to, as we get into our last 10 minutes or so, I want to talk about, okay, we know this is coming. We cannot avoid losing our estrogen. We can replace our estrogen, and that's a good follow-up conversation. But to summarize, what are the mandatory habits? And aside from replacing estrogen, what age do you want your women who come to you as patients to say, I have got to have this specific conversation? Not just talking about regular dental care, but when should you bring up, okay, I'm noticing these lines, what's going on in here? So what are the mandatory things people have to do, which you've probably told me 97 times when I'm sitting in your chair, but what are the mandatory things? And then at what age should we start?
The reality is that every patient should start listening to your body, because there's not a specific number that after this age you're gonna start. It's like a switch. Like somebody will tell me, growing up, they would tell me, no, just wait till you hit 40 because you're gonna need glasses. It happens that it was like a switch. At 40, I'm wearing contacts, but teeth-wise, there's a lot of factors. Like it depends on how your dental IQ, right? Resources, because nowadays your kids, you give them all the tools so they can succeed and have like proper teeth.
Yes.
Like using my daughter as an example, she's 22. She's already graduated from college.
Okay.
I noticed a little bit of receding gum at 22, and I told her, I'm going to send you to the periodontist. Okay. Those are kind of specialized procedures. And last Thursday, she got gum treatment at 22, right? She's like, oh, but the doctor told me that it's little. And I was like, get it done. Okay. Why
so
do you want to wait?
32 with a tooth coming out.
Correct. You just get it done. So I was taking care of her the whole weekend because her face is like
painful.
swollen. So you want me to even out your face so I can just, because it's just like a chick her like this, but now she's getting better,
Yeah.
But the reality, there's not a specific number. You have to, it's like the same way you're listening to Dr. Wright and she's very good at telling you the proper things to do to stay healthy and longevity. Teeth is part of it. You have to listen to your body. I sometimes get patients and with the team, with the staff, say, aren't they looking at their teeth when they smile? Because sometimes you can see all the plaque accumulation. You can feel it. Like if your teeth are dirty, you can feel it, So there's not a specific day. You have to listen to your body. You have to floss properly. And if you don't have the resources to visit a dentist, make sure that you get all the tools to just clean your teeth properly. And if you notice plaque, if you notice the yellowness in between your teeth, the shiny of the gums, that's not normal, or a red halo around your teeth. Because what happened is that once you start getting to that phase where estrogen start to decrease, the inflammatory response is very aggressive compared to a normal person.
Completely aggressive.
It's like, it's like hormonal disturbance. It's like when we have patients that are pregnant. Their hormones are like crazy. So even if they get very good home care, sometimes there's like a lot of bleeding.
Well, let me ask you this. I mean, this is a divergence, but we know for these young women that you're taking care of post-pregnancy, that during pregnancy, their estrogen can be in the thousands. But then afterwards, as they're breastfeeding, it plummets for long periods of time. So is postpartum, if we're going through a lifetime of oral health, is postpartum as women are breastfeeding also a danger time because of the lack of estrogen, the increased inflammation?
The lack of sleep.
Oh, of course, of course.
And then they say, "Well, I've not been sleeping well. My baby's not sleeping well," and then they neglect themselves because they have to sleep, so they don't brush properly, and they get the inflammation as well. So, again, everything is like a
it works together. You know what I think? Aside from maybe it's just me, maybe I'm the only one that has ignored thinking about this, except when I have to think about it. But in general, what I have found being a clinician for this long is people are even though our bodies are talking to us all the time, I'm sure you would say, I say bones are master communicators talking to us all the time. We just don't know how to listen. Maybe it's the truth with our oral cavity, because what you've described, if we had a clue of what to look for, besides the difference between the top of our teeth and the enamel part of our teeth, the gums, is there a red halo? If we knew the language of our oral cavity, we would be able to say, oh my God, something's happening. Let's go find an expert.
And if you look at the importance of the mouth and teeth, like the body is like a Ferrari, right? You have to put good fuel, right? So if we don't have a proper oral health, the fuel that you're going to start feeding your body is not going to be the best and process food. Like you need a specific amount of enzymes that are in the saliva to start the digestive process.
It starts in your mouth.
So you have less saliva, right? You need to process and chew your food so that way the digestive process is easier for the body. So if you don't have teeth, you're going to be swallowing stuff, okay? And again, I'm going to kind of wrap up, start like getting like what happens, right? So menopause or perimenopause women, they start having, again, less estrogen, which will be less collagen, right? And if you start on top of that, add the sleep apnea, then that's like a chaos, you know? And then when you have less collagen, less repair, it damages the soft tissue, the gums, right? Receding gum, just to summarize. Hypersensitivity because the root is exposed. Inflammatory is very aggressive. Also, the oral mucosa, thinning of the liner of the teeth, which is compromised repair, and then you can see the peeling of the skin. If the patient start having all that issues, that more higher incidence of cavities. Okay, now when the patient have sleep apnea, they start grinding the teeth. So if the periodontal ligament, which is the ligament that supports the teeth and connects the teeth to the jawbone, if that ligament gets affected because of the lack of collagen, then periodontal disease start to just happen. The teeth start to just get loose. And if on top of that, you're grinding your teeth at nighttime, that's a bad combination.
Pressure.
And they start getting all the teeth moving. You can see the wear. Teeth start to just get flat. You can see jagged edges on the teeth. It's like an EKG on the edges. And then that could become a cosmetic emergency, because then social media is there. So I don't like to see my picture on my social post with broken teeth. And then the patient goes, and again, I'm tying now the cosmetic part of it. Then they go to smile design clinics, and that's a different topic, because they want to have this toilet bowl white teeth, which they do it with composite resins, and they don't finish them well, and then they come with fire on their gums, because they don't teach
cavities below,
and then cavities. So it's like because again they want to look good, but the theology is that they were wearing down their teeth and they don't like the way they look. Sometimes we have to just explore the possibility of clear aligners, not for beauty, but for function. You want them to eat properly and not chip their teeth or grind their teeth. So that's when dentistry, they look at sometimes at the dentist as the person who is going to solve their problem when it comes to the aesthetics. But there's so much more that we can help, And once just wrapping up, we have the problem with the teeth, and we start affecting the periodontal ligament. We end up losing teeth. We want to have fixed teeth again. So they request implants. But because of the osteoporosis or because of the menopause, and if they having issues with the jawbone and the collagen that supports the jawbone, then they request implants, which are not possible because they don't have the bone, or they're already taking a medication to reduce the remodeling of the bone, and then they end up with fake teeth, and then now it's not only about teeth, it's about the emotions. The emotional part of it. And then they start, I have patients, and I used to work in Haines City a long time ago, that the patient husband never knew that she was wearing dentures.
Really? How's that possible?
I don't know. But it's that emotional component. You don't want, teeth
Somebody
are so
to
important.
See you.
You could be the smartest person in the room, But if you're missing your front tooth,
Right. It makes a difference.
people is going to look at you
Yeah.
differently.
Completely.
You know? So teeth are so important, but it's not only for the look.
Yeah.
It's just for everything.
You have to look behind the enamel.
Yes. Yeah. It's just true. That's a good hashtag.
Hashtag look behind the enamel.
But yeah, it's about teeth. But again, it's not only about teeth. Again,
It isn't.
It's about everything. And everything, I would say, start in the mouth. Because if you feed your body with good nutrients, the body will behave and do whatever you want them to do.
I think today's conversation is not only fascinating, but just the beginning. I think anybody listening is going to be like, oh my God, oh my God, oh my God. They're going to run right to the mirror, the 3X magnifying mirror,
Yes.
which if we're all honest, we have at this age, and are going to do a big wide smile and start looking.
Yeah.
Because these are things that
So
people don't even see.
signs that they have to look for.
Okay.
Okay.
Are you listening?
Yes.
Signs you have
Listen.
to look for.
Yes. So first of all, you have to have very good products. Okay. You have to have like good flossing in your counter, open. Okay. Yeah, because you ask the patient, "Do you use a floss?" Yes,
Yeah.
I use floss. Or if you prescribe a night guard,
Yeah.
because they're grinding their teeth.
Yeah,
that's
do you use it?
Do
Right.
you have a
I
night
got
guard?
it.
Yeah, I use
say
it.
that
Are you
too.
using it? No.
Yeah,
So-
I say the same thing about
So again, floss, good brush.
Yeah.
Usually electrical toothbrush are great. And if you try already an electrical toothbrush and you brush with a manual after, you notice a big difference.
So 2 minutes, is that how
yeah,
long?
actually, I don't like to put,
You don't
put a
like
name,
to put
but
time on it?
not time, but there's different brands out there. Like my preference is like specific brands, Sonicare, for an example, and it's because it stay on for 2 minutes.
Yeah.
There's another one, Oral-B, which is a great product as well, but there's no
You have to
timer.
time
You have
it.
to continue. This is my funny story with that. They gave me one for me to test. And I'm so used to the Sonicare, I was waiting for it
to go off.
And then when I look at and there's a timer, it says the time. It's like 3 minutes and something. So I was like, oh my God, this is not going to
Really clean teeth that day.
Yes. So the toothbrush, a good mouthwash, especially alcohol-free.
Yes, because
Alcohol
we don't want to
dehydrates.
swallow.
Not only that, it dehydrates. So if you have a patient that already have dehydration because they
what's
are
the point of that?
mouth breathers, the gum is very fragile. And on top of that, you're going to put alcohol that it'll dehydrate even more.
Yeah.
It's very detrimental for the gum. So alcohol-free, like just to put a name, Listerine, they have a, even though they kill all the bacteria in the mouth, which is not a good thing.
It's not good.
Because you need good bacteria
do.
as well. But they have the alcohol-free one. And there are a lot of products nowadays out there. A good toothpaste, especially if you're having receding gum, you'd have to have a higher concentration of fluoride to just protect the root surface and the enamel, and also the prevent sensitivity and cavities. So the products. Then you're going to start looking for receding gums. You can pull your teeth. Usually it's going to have not that much happen in the front area. Receding gum could happen for various reasons. One of them is the reduction of collagen, which is what we've been talking
Really
about.
critical.
Also grinding, again, it's a catch-22. When you grind, the teeth have a tendency to flex. So the enamel at the base of those teeth that flex the most are the enamel that is going to go the fastest. So those teeth, most of the time, is going to be in the posterior areas, the receding gums. So when you start noticing that, yes, you have to get checked up. It's easy to replace or repair gum when it's starting to just recede than whenever a lot of the tissue is already gone, because it's very difficult to gain 100% of that tissue with the periodontist, for an example. Then you have to have grafting, and they have harvest tissue from the roof of the mouth. So it's
it's so complex. Let's not
keep it
do
simple.
that.
Let's keep it simple.
Let's not do that. Yeah.
So then brown spots in between your teeth. The cavities usually start like kind of decalcification, which are like white patches in between teeth. Then they can turn kind of yellowish, then it's dark brown, and then you can see an opening. Or you could be eating something soft, like every patient breaks their tooth eating bread. So there's something, that's what I get a lot. No, I was eating something soft, like a piece of bread, and my tooth broke off. And so, okay. So the enamel is the stronger part of the body, but it's brittle.
It's brittle.
So if you don't have the support of the dentin, which is underneath, it's just like an eggshell. So the cavities usually start eating the under the enamel until the point that you can be eating something soft and you're going to break your tooth. So the cavity was already developing. That's the problem. So regular checkups that prevents all that from happening.
Yeah.
Also, you have to check for sleep apnea signs. Sleep apnea, size of your tongue. If you open your mouth and you don't see the uvula,
that is
Tongue's
considered
big.
what we call Melendez 4, which was used for anesthesiologists and how to
Oh,
grade
yes.
the the intubation
How to
process.
intubate.
So when you don't see the uvula, you don't see anything back there, that's a good sign that you're having sleep apnea, because you fall asleep
And it all
and that's
obstructs.
like a dam back
Yeah.
there, like a seal. Size of your tongue. Okay, if you feel like you have scalloping, like the you can
it's
see
rubbing the teeth?
It's your body's screaming for oxygen. So when you fall asleep, not only you're just going to start grinding, your tongue is going to try to move forward. So it puts
to
the
give
pressures
you a-
against the teeth. So you
Got
get
it.
the teeth mark already in
I
the
am
tongue.
so going to be looking
So-
at people's mouths from now on. Stick out your tongue. Let me see your
Stick it out,
scalloping.
yes. So those are signs that you and the grinding, because the body, in order to open the airway, when you flex your muscles, they get tight and they get
Yeah.
kind of, so that happens in the jaw and also in the airway. So you clench to just that platysma and those muscles, strap muscles, to just get like tight, so that opens the airway. So you're all the night like grinding and trying to just clench your teeth, and goes back up, front and back until you destroy your teeth.
You know, I listen to the world of menopause every single day, and there should be more conversations like this, because I hope that everybody listening today has come away with what is the biology, starting from the outside, going into the inside. What are the signs to look for? What are some of the solutions? I hope that you'll, if you don't have a established relationship with a dentist like Dr. Menendez, or your entire staff, which are remarkable, that you go find one, because this isn't going to just go away, right? These are active intervention steps. It's not like the switch turns off and you go back to
Correct.
15-year-old teeth again, right? So I'm so thankful you came. I think there's so much more to talk about. but
And even if they have a dentist, just to have this conversation.
have this bring it up if
Yes,
it's not brought up.
What's happening?
Yeah.
Because there's so many things out there that could improve the life and quality of life. And again, the last thing about sleep apnea, when you have sleep apnea under control, the inflammatory process decreases,
down.
collagen goes up again. So if you think, or you've been told that you snore and you gasp for air, start getting, the easiest thing is to just get tested. Just get an HST, or request that. Me as a dentist, by law here in the United States, we cannot request an HST to be covered by your insurance. But if you have a physician or a cardiologist or your sleep medical doctor, request an HST, a home sleep test, or a polysomnogram to get tested first. I think that should be the first step.
Yeah.
Let's
you can
control
know.
the sleep first. And if I can sleep better, I will feel better. Everything will start recovering. Some patients takes a lot of medication for high blood pressure, and when they control the sleep apnea, they don't need that many medication to control the blood pressure. So there's so many things.
There's so many things
that we can talk about.
Because you are a person who treats whole people with teeth. Thank you so much for being here.
Yes. Thank you. Thank you for having me.